Hi everyone, I'm Ashraf Kaji, and in this video I'm going to be introducing you to non-randomized study designs. To provide some context, studies are generally categorized into two types: observational and experimental. Experimental studies can be further divided into two types: non-randomized studies and randomized control trials. In this video, we will focus on non-randomized studies. When planning for or critically evaluating non-randomized study designs, there are a few key features that need to be considered. Let's start with the purpose of non-randomized studies. Non-randomized studies are a type of experimental design that aim to investigate the potential effectiveness of an intervention, like a treatment program or policy. They are often conducted when a more rigorous experimental design, such as an RCT, is not feasible or ethical to conduct. Non-randomized studies are experimental since researchers actively manipulate variables or intervene in some way. They manipulate the independent variable. Non-randomized studies may resemble RCTs in many respects, but they differ in that participants are not randomly assigned to groups. Typically, they are longitudinal in nature, meaning they collect data at several points in time. Next, we will look at appropriate research questions for non-randomized studies. Although there are a number of research questions that can be answered by these designs, one example asks, is an emotional regulation program feasible to implement in schools? In this example, we may pick one school to receive the intervention and another school who does not. Schools were not randomized to the groups. Another research question posed is, does a 12-week CBT intervention show promise in reducing anxiety in adults 12 weeks post-intervention? In this study, all participants received the intervention. They completed a baseline assessment prior to the intervention, followed by a post-assessment for comparison. The baseline assessment essentially serves as the control group, allowing researchers to assess changes in anxiety symptoms over time. You will notice I did not use the term effectiveness. Non-randomized studies can suggest potential effectiveness only. Consideration number 3 is the sampling method. The sampling method in any experimental study influences how well the study represents the target population and whether there are biases in participant selection. Different sampling methods impact the study's external validity or generalizability. Although generalizability isn't always the primary goal of experiments, it's important to consider how strict the inclusion and exclusion criteria are. For example, a trauma intervention study might exclude participants with depression or substance use issues. However, if these criteria are too narrow, it may limit the relevance of the findings to real-world populations where these conditions commonly overlap. Researchers should think carefully in advance about which participants to include, so that the results can be applicable to broader groups if needed. Sample size. Sample size is critically important in non-randomized studies. A larger sample size increases the statistical power of a study, meaning it improves the ability to detect a real effect or difference between groups if one exists. For example, imagine you're studying whether a new therapy reduces anxiety. If you only include 10 people, it might be difficult because the small sample could lead to unclear results. If you include 100 or 1,000 people, it becomes much easier to determine if the therapy is reducing anxiety. However, it's important to remember the limitations of non-randomized studies when determining cause and effect. The larger the sample, the more confident you can be that any difference observed is real and not just due to chance. This is why researchers always conduct a power calculation to determine the number of participants they need to test their hypothesis. It can be very expensive if you only need 300 participants and recruit 500, and may have some ethical considerations. Before we go into the study details of non-randomized designs in public mental health, it's important to zoom in on the independent variable, particularly given that these studies usually focus on testing and intervention. This is consideration number 4. The independent variable is the factor that researchers deliberately manipulate to observe its effect on the dependent variable or outcome. It's crucial that the independent variable is clearly defined. We need to know exactly what the intervention group are exposed to, and also the control group if there is one. When considering the independent variable later in our analysis and interpretation of the findings, it's also important to investigate intervention retention. If an intervention is an 8-session school-based intervention, we would like to retain as many participants as possible. Hopefully they all complete the 8 sessions. In reality, some participants may only complete 6 or 7 sessions, so we wouldn't have 100% retention in the intervention. It is vital to know the dose, or how many sessions the participants actually received. The 5th key feature of a non-randomized study design is that participants are not randomly assigned to groups. Since there's no randomization, we can't guarantee that the 2 groups are identical in all respects. It's also important to clarify that pre-post studies do include a control group, with the baseline data serving as the control for comparison in these studies. Any observed differences in outcomes between 2 groups can be due to having non-equivalent groups to start with. We cannot say with confidence that our independent variable caused changes in the dependent variable. Non-randomized studies cannot fully eliminate confounding variables or threats to internal validity, but do give us some idea of the potential effectiveness and help clarify the direction of effects. Let's now explore these threats to internal validity in a bit more detail. In non-randomized study designs, participants are not randomly assigned to groups, exposing the study to various threats to internal validity. This lack of randomization can lead to non-equivalent groups, increased biases, including an inability to fully control for confounding variables. As a result, researchers may find it difficult to confidently attribute differences in outcomes to the intervention itself. Let's use an applied example concerning a school-based social-emotional learning intervention for symptoms of depression and anxiety among learners. This is an indicated prevention intervention for adolescents who are experiencing symptoms of depression and anxiety. We gave youth a baseline assessment before the intervention to measure depression and anxiety. They received 8 sessions of the program and then were followed up using the same assessment again post-intervention. This is known as pre-post study design. One of the threats to internal validity is history. History refers to external events occurring during the study that could influence participants' anxiety levels independently of the intervention. Adolescents in the 2 groups may not have experienced the event. For example, perhaps in one school there was massive taxi violence impacting the lives of kids in some areas near the school. Maturation occurs when participants naturally develop and change over time. For example, students might naturally outgrow anxiety as they progress through the school year, particularly if they have successfully navigated an exam period, for example. Next, testing effects are a threat to internal validity, given repeated testing can influence outcomes. For example, students may perform better or feel more comfortable with anxiety assessments due to repeated exposure. This is particularly important with pre-post designs when there is no control group. Selection bias is another potential threat to internal validity. Differences between groups at the outset can lead to skewed results, making it unclear whether the intervention or pre-existing group differences caused the observed changes. Perhaps one of the schools has Oprah Winfrey as a celebrity teacher, while the other teacher has just graduated from university. Moving on to regression to the mean. This threat to internal validity appears when extreme scores, such as very high anxiety, tend to move to the average over time. This could be mistaken for improvement due to the intervention. What is very high has to come down. The only threat to internal validity that is not limited through randomization, so is present in RCTs and non-randomized designs, is mortality or attrition. This refers to participants dropping out of the study or lost to follow-up for any reason. This can lead to biased results, especially if dropouts are related to the intervention. For example, those with higher anxiety might be more likely to drop out of the study. A key feature of non-randomized designs is to be aware of the types of designs. There are several non-randomized studies to choose from, some of which are shown here. Examples are pre-post studies and non-equivalent group studies. Let's start with the pre-post test designs. In a pre-post test design, the dependent variable is measured once before the program is implemented and at least once after it's implemented. Imagine, for example, a researcher is interested in studying an anti-drug education program aimed at forming elementary students' attitudes towards illegal drugs. The researcher could measure the attitudes of students at a particular school during 1 week, implement the anti-drug program during the next week, and finally measure their attitudes again the following week. If the average post-test score is better than the average pre-test score, then it makes sense to conclude that the program might be responsible for the improvement. Unfortunately, we cannot conclude that the independent variable caused the changes in the dependent variable in the study, because there may be other explanations for why the post-test scores are better. First, there are several threats to internal validity that may be influencing the findings. History is a potential threat to internal validity that may be playing a role. In other words, certain events may have happened between the pre-test and post-test. Perhaps students saw an anti-drug program that went viral on social media. Or perhaps a celebrity died of a drug overdose, and many of the students heard about it. Finally, in pre-post test design, spontaneous recovery could be affecting the results. Let's think about intervention studies that focus on psychological interventions where spontaneous recovery could be affecting the results. In a classic 1952 article, researcher Hans Eysenck summarized the results of 24 pre-test, post-test studies, showing that about 2/3 of patients improved between the pre-test and the post-test. However, Eysenck also compared these results with archival data from state hospitals and insurance company records. These showed that similar patients recovered at about the same rate without receiving psychotherapy. This comparison led Eysenck to suggest that the improvements seen in pre-test, post-test studies might be due to spontaneous recovery or spontaneous remission, rather than the effects of psychotherapy. It's important to note that Eysenck did not conclude that psychotherapy was ineffective, but rather that there was no conclusive evidence to prove its effectiveness. He emphasized the necessity of properly planned and executed experimental studies into this important field. The second type of non-randomized design we will describe as the non-equivalent groups design. In this design, participants are not randomly assigned to groups, unlike randomized control trials. These designs are useful when random assignment isn't feasible, like when evaluating public policies or educational programs already planned. Since there is no randomization, the groups may differ in ways that affect the results. In school-based mental health intervention studies, for example, there may be threats to internal validity. Differences between schools, such as student demographics or available resources, could influence the outcomes, making it harder to determine whether the intervention itself is responsible for any observed changes. The sixth key feature of non-randomized study designs is how data is collected. Data in non-randomized studies is collected through questionnaires, interviews, or observations. Participants are asked about their conditions, behaviors, or other characteristics. Non-randomized designs assess multiple variables at the same time. These can be demographic, social, behavioral, or health-related variables, depending on the study's focus. There is usually a primary outcome variable and several secondary outcomes. Reports of non-randomized designs generally state the primary outcome of interest upfront. Data for non-randomized studies are typically collected at multiple time points, making them longitudinal studies. So we have to put careful effort into recruiting our participants in a non-randomized study design. Now, how can we keep them? Keeping people in our study is so important. Terms such as non-retention, dropout, attrition, and mortality all mean the same thing. We need to avoid attrition for study follow-up assessments, given the longitudinal design. Researchers spend a good amount of their time putting strategies in place to ensure follow-up assessments are completed. Some non-randomized studies conduct follow-up at 3 months, 6 months, 12 months, and even longer after the intervention. Follow-up strategies could include telephone follow-up, home visits, and incentives, for example. Consideration number 7 is the measurement of variables in non-randomized studies. An essential aspect to consider in all research studies is how constructs are measured. Selecting a primary outcome in experimental studies is not straightforward, and researchers must engage with the existing literature, clinicians, and importantly, individuals with lived experience. Measures included in non-randomized studies, particularly the primary outcome, should be reliable and valid in the setting that they are used. This means that they have to have good psychometric properties. Psychometric properties refer to the characteristics and qualities of a mental health measure that assess its reliability, validity, and other important aspects of measurement. Reliability refers to the consistency and stability of the measure, while validity refers to the extent to which a measure accurately captures the construct it is intended to measure. A key characteristic in all studies is the potential for measurement or information biases. There are several types of measurement or information bias to consider when conducting or evaluating these studies. This is not by any means an exhaustive list. Given the self-report nature of many observational studies, measurements might be influenced by the participants' awareness of being studied, known as the Hawthorne effect, or by the observer or researcher's expectations, referred to as observer bias. Further, given the self-report nature of many observational studies, recall bias may be present. Recall bias occurs when participants fail to accurately remember past events or experiences. Finally, social desirability bias arises when participants provide responses they believe the researchers want to hear. When reading a paper, it's essential to recognize that researchers may not always be able to prevent these biases. However, they should acknowledge their potential presence and account for them when interpreting the study's findings. Transparency about these biases, along with an estimation of their potential impact, should be addressed in the discussion section of the paper. Another consideration when it comes to non-randomized studies is taking note of reporting guidelines. The Equator Network website is very helpful when it comes to identifying appropriate reporting guidelines, as you can see from the list on the left. Equator stands for Enhancing the Quality and Transparency of Health Research. You may also find guidelines as you search the academic literature. An example of guidelines specifically for quasi-experimental studies is TREND, which are reporting guidelines for non-randomized and quasi-experimental studies. Just remember, for intervention studies, you can also look at the TIDIA guidelines to make sure you are describing the intervention to a high standard. Putting all of this information together, we can identify several strengths of non-randomized studies. First, non-randomized designs are less resource-intensive than other designs, like randomized control trials. They typically require fewer resources and demand less time commitment. This makes non-randomized designs generally more cost-effective or cheaper than other study designs, often requiring fewer resources and lower overall expenses. Non-experimental designs often have more real-world applications than more controlled studies. They observe participants in natural settings, producing results that are more relevant to real-life contexts and applicable to broader populations. Essentially, they may have better external validity than more controlled experiments, such as RCTs. Finally, non-randomized designs are often considered ethically flexible. They allow researchers to study interventions that may be ethically problematic to randomize, such as treatments in emergency situations or necessary healthcare practices. We can also identify several limitations of non-randomized designs. First, lack of randomization is a key limitation. The absence of random assignment can lead to differences between groups that are unrelated to the intervention, making it harder to establish a clear cause and effect relationship. Threats to internal validity is another limitation of these designs. Non-randomized designs are vulnerable to various threats to internal validity, such as history, maturation, or regression to the mean. Non-randomized designs are not sufficient on their own to definitively say that an intervention works because they lack the rigorous control found in randomized control trials. Therefore, non-randomized studies are often needed to be complemented by other study designs, such as randomized control trials or longitudinal studies, to more reliably establish cause and effect. These additional designs help confirm that the observed outcomes are truly due to the intervention and not other factors. I hope you found this video helpful in understanding the key features of a non-randomized design. As a reminder, here is a list of 10 things to consider when planning or assessing an experimental study. Thank you for listening.